okay, we can focus on everything that didn't go well, but frankly, there's been incredible, unprecedented success vaccinating, billion people in no time. That's never been done. But also, your point about local manufacturing I think, is very important. When we think of inequity, I think we will always have a world where if you are a democratically elected or not democratically elected president or prime minister, your first expectation is that you take care of your own people. So we need to make sure, and that means that those who have no manufacturing or are less, powerful or wealthy will not have access to the products. So that's one, for me, a huge, important geopolitical reason to have that. And that means in the first place in sub-Saharan Africa. And there's enormous progress there. So I'm optimistic there. Now, trust is, of course, key. And we've learned that it's one of the big lessons from this pandemic also. And that was most extreme with people who lack, let's say, confidence in vaccines. And then all kinds of rumors about it, fake news, misinformation. Some of it, I would say, based on legitimate concerns. Is this, working well? It's a new vaccine, so on, fine. And that can be answered. But some of it is not so spontaneous and was generated either domestically, politically, ideologically, or even through foreign powers. We should not be naive about this. And for me, the big lesson is that whatever we do in health, whatever we do in public policy, we need to listen to people, we need to include people, and communication is as important as having the product. Because having a vaccine that people don't take is not going to save lives. And it's the more important that this is not an academic issue. It is really about lives and about life and death. And if people, if there is this continuing mis and disinformation in some populations, that's going to cause deaths.
But what do you say to those who are anti-vax, who want it to be their own personal choice? Shouldn't they have that, Anil?
Well, I would like to start. So, first of all, there are, there are different types of concerns. And as I said, some people who are concerned about side effects or whatever. I think there with information, first of all, listening and talking and addressing their issues. And that can work. And not just being arrogant and say we know it all. Now, that for some people who are like anti-vax, like the earth is flat, that's far more difficult. And that can be very dangerous if it's, for example, in healthcare workers, in people who work with vulnerable people. There, I think at some point, mandates may be important to